Hello everyone and welcome back to Clinical Cousins YouTube channel where we're going to talk about how getting high can kill you. I'm not talking about getting high on marijuana, not talking about getting high on pot news. I am talking about getting higher in elevation and what that does to your body. So there's something called altitude sickness that you might have heard of. Well, what is altitude sickness? So when we travel to higher elevations, I've drawn some mountains right here. I graduated from nursing school, not art school. So I've drawn some mountains right here. Now, what happens when we go up to higher elevations, when we go up to the mountains? Well, if you're, say, at the beach, there's a lot of oxygen pressure. It's driving oxygen into your lungs, into your blood. Okay, so if you go up to higher elevations, there's actually less of this oxygen pressure. So less oxygen ends up in your blood. That's why we have the frowny face right here. And that is why you're going to feel really, really crappy. You're going to be hyperventilating. You're going to feel worn out, even just walking up the stairs. In Colorado is a lot harder than walking up the stairs at the beach. So how does our body sense this? How does our body adapt? Well, it's very good at adapting. What it does is our kidneys will produce something called hypoxia inducible factor 1 alpha, HIF1 alpha for short. Now, what this HIF1 alpha does is that it actually tells the fibroblasts in our kidneys to produce the mRNA cooking instructions for a substance called EPO. This is the good stuff, okay, but it's also the bad stuff. EPO actually travels all throughout our body and it acts on our bone marrow. Our bone marrow is what produces red blood cells. So what has happened? We have decreased oxygen. Our body does a lot of different things to increase red blood cell production so that we can efficiently capture whatever little oxygen we have in that higher altitude so that it can be delivered to our tissues. So this is how our body reacts to being higher in altitude. Now, off the top of your head, you should know just a little clinical nugget that the treatment for altitude sickness is acetazolamide. Okay, but we're going to talk about what really kills you, what is really dangerous for taking if you're taking EPO for performance enhancement reasons. So EPO is sometimes given to cancer patients, patients who have kidney dysfunction because they can't produce enough. So EPO, it's actually very dangerous because if you increase the amount of red blood cells too quickly, you can put yourself in a hypercoagulable state. Your blood is going to become so thick that you're going to be at high risk for clots. So I'm talking about DVTs, the deep vein thromboses, and the PEs, pulmonary embolisms. So if you're taking EPO, like a cyclist in the Tour de France, famous for this, so they will take EPO to increase the amount of work in cycling that they can do, but you'll actually find out a lot of them will die in their sleep from a blood clot. It kills them because they don't know that increasing your red blood cells too quickly is very, very dangerous. But let's talk about something that's very, very important to understand clinically if you're going to be treating your patients effectively and really understand bigger picture of what's going on. I'm talking about the oxyhemoglobin dissociation curve. Okay, so real quick, to simplify things, what is that little thing that we put on our patient's finger and we put on their ear? It's called the pulse oximeter, the pulse ox for short. But what does it actually do? How does it actually work? Well, it's important to understand because this is going to be going on every single one of your patients if you work in the hospital setting, right? So a pulse ox, it actually is a device that shoots little light rays down at your hemoglobin, and if your hemoglobin is attached to oxygen, these little light rays will bounce back up. And that is how the pulse ox measures your oxygen saturation. Okay, so this is not your oxygen in your arterial blood, which is around 80 to 100 millimeters of mercury. This is the saturation of hemoglobin. Remember, a saturated sponge would be like a sponge that has a ton of water on it. It can't have any more. This is the same thing with hemoglobin. Imagine hemoglobin is sort of like a sponge, and it is soaking up the oxygen. So if I gave you 100 hemoglobin traveling in our blood. This is a finger, by the way, if you couldn't tell. So 100 hemoglobin traveling this way. If every single one of those hemoglobin were saturated with oxygen, the pulse ox would read 100%. Now, if I gave you 100 hemoglobin and only 75% of them were saturated with oxygen, it would give us a pulse ox of, you guessed it, 75%. So this is a very important point. We need to understand that the pulse ox it does not closely relate to our arterial oxygen content. So here are some numbers that you should drill inside your head, some very key factors that affect our arterial oxygen. So pulse ox of 100, arterial oxygen of 100 millimeters of mercury. So it could be 100 or it could be much more than that. If your pulse ox on the monitors is saying 100, either your patient has 100% partial pressure of oxygen in their blood, in their arterial blood, or it is much more than that. They can actually have oxygen toxicity. Remember, this only goes up to 100%. So if your patient is on high flow oxygen therapy, if they might be on, say, a non-rebreather at 10 liters. That's giving them 100% oxygen content. You're forcing a lot of oxygen. They can actually have oxygen toxicity and you wouldn't know it. So this is not always a good number. A good number is really anywhere from like 95 to 98. That's sort of the sweet spot that we like. So let's say that pulse ox on the screen is showing 90. What does that actually mean? Most of you think, oh, 90 is good. That's a great passing grade. Well, actually, if your patient doesn't have COPD, this can actually be sort of a scary thing because it means that their arterial oxygen content is around 60. And this is not good. This will quickly deteriorate into something that you don't want to play catch up on. So be sure to, if your patient has 90 and don't have chronic lung disease, they don't have the lung cancer, COPD, that's the chronic bronchitis and the emphysema, go check on them. There might be something going on there. Now, if their pulse ox reads 75%, they say, oh, good passing grade. This is not a passing grade in terms of pulse ox. This means that their arterial oxygen content is around 40. This is not sustainable. This is not good. Pulse ox reading 50% on the monitor, they don't have half. It means that their arterial oxygen is usually around 25. So this is not sustainable for life. You're going to be in big trouble if you don't do something very, very quickly to reverse that. So we're going to talk about a concept that is very, very confusing for a lot of people. I'm going to break it down so that it's super simple to understand. And I'm talking about the P50. Okay, so P50. P50 is the oxygen needed to saturate half of your hemoglobin. Okay, so P50 is the oxygen needed to saturate half of your hemoglobin. So if you have oxygen right here, how much oxygen do you need to give to saturate half of your hemoglobin? Well, this is an interesting question. Okay, so usually, let's say it's around 25 to 30. So if we have a partial pressure of oxygen in the air that's around 25 to 30, that means that half of our hemoglobin will be saturated. This is normal. This is a good thing. So let's talk about left and right shifts. These are what really confuse people. You're likely going to get some test questions on it. So let's talk about right shifts. Right off the bat, I want you to associate right shift, your hemoglobin is loose. It's slippery. Okay, left shift, your hemoglobin is tight. Okay, it likes to hold on to oxygen. So what are some things that could cause our hemoglobin to become more slippery? What is this going to do to our P50? So if we have a shift to the right, that means that it is taking more oxygen just to saturate half. So our hemoglobin is not doing a very good job of holding on to the oxygen. And you're thinking, well, that sucks. No, it's actually a good thing, because the situations that produce a right shift are situations where we have to have increased oxygen delivery to tissues. So if you have acidosis, if you're working out super hard, your body's really hot, if you have 2,3 DPG, what this is going to do is situations where your body's working harder is going to cause a right shift. Your hemoglobin is going to be more slippery. That means that oxygen is going to leave the hemoglobin and go to your tissues where it is needed. Okay, so now we're going to talk about the opposite of that. Remember, right shift, hemoglobin is slippery, it's loose. Left shift, hemoglobin is tight. It wants to hold on to that oxygen. So you could probably guess what are situations where my hemoglobin is going to have a left shift. The P50, we see that less oxygen is needed to saturate 50% of our hemoglobin. That means that our hemoglobin are really holding on tightly to that oxygen. Well, it's actually opposite situations that cause the right shift. So left shift, what causes our hemoglobin to hold on to oxygen more tightly? It's going to be situations where our body is not working very hard. Lack of hydrogen ions. So we have some types of alkalosis. We have cold environments. We have lack of 2,3 DPG, so our body's not working very hard. That means that our hemoglobin is going to hold on to that oxygen more tightly. So just to summarize, right shift, okay, right shift, that means that more oxygen is going to be needed. our P50 is going to increase because our hemoglobin is more slippery, it's losing oxygen, and we have left shifts, our hemoglobin is tight. Less oxygen is needed to saturate 50, so our P50 is going to decrease, and that means that our hemoglobin is going to hold on more tightly to oxygen. It's situations where our body is not working very hard. So now we're going to talk about something that you might see, hopefully you never see it, if you're working in the emergency department, ICUs. I'm talking about carbon monoxide. This is why it's so important to have detectors in your home. But let's say that you have a guy, John Doe, and he's recently divorced, kids died, horrible life events. He feels suicidal. He feels like he wants to take his life. Well, if he goes in the garage, he starts his cars, and he locks himself in. Those car fumes are going to have lots and lots of carbon monoxide. Okay, so carbon monoxide, very dangerous. And why is it dangerous? Well, our hemoglobin, it likes oxygen. It thinks oxygen is great. But what our hemoglobin desires, it craves, hemoglobin's dream girl is carbon monoxide. This is a very, very dangerous substance, and I'll tell you why. So carbon monoxide binds to our hemoglobin. It has an affinity for carbon monoxide, our hemoglobin does, 250 times greater than it does for oxygen. So what it does is our hemoglobin will take up all the carbon monoxide it can. The only problem is carbon monoxide has no functions in our body. So we're not delivering oxygen to tissues. Carbon monoxide is taking the place of oxygen. Not only that, carbon monoxide also produces a shift to the left. Our hemoglobin gets really, really tight. Our hemoglobin thinks, oh, I have a ton of oxygen. I'll hold on to it. I'll get really, really tight. Well, this actually makes oxygen delivery at our tissues even less. So hemoglobin is bound to carbon monoxide, and it doesn't want to give up any of its oxygen. This is why carbon monoxide poisoning is extremely, extremely dangerous. So initially, you're going to get them in. You might put them on a non-rebreather, and if that doesn't work, you might put them on a CPAP, and eventually maybe even a hyperbaric chamber so that you can force oxygen. You can rip that carbon monoxide out, put oxygen on the hemoglobin, and hopefully your patient hasn't had too much brain damage, heart damage, kidney damage, so that you can save their life. But as always, thank you so much for taking the time to learn with us today, and remember to like and subscribe for more content. Thank you.